Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Kym Klimek, who is a licensed pharmacist, certified hormone replacement therapy specialist, and certified functional and lifestyle clinician coach. Kym's personal journey of struggling with endometriosis, hormone and gut-related issues, stress, and multiple surgeries is what led her to seek information about root cause medicine strategies. Specifically, after her second laparoscopic surgery for endometriosis removal, she was given a book by a coworker that focused on a more natural approach to healing that truly changed her life and led her to questioning a lot more of what she was educated on in grad school regarding medicine and health. She instantly knew that she couldn't turn her back on the power of supporting the body through a more holistic approach, and now she does that for others as well. Through her business, Innate Healing Performance, Kym specializes in helping others with hormone-related issues, gut and digestive imbalances, autoimmune and chronic health conditions, and for those looking to optimize their wellness so they can live vibrant, healthy, energized lives. Outside of her professional life, Kym loves reading, cooking, researching, training for triathlons, which is swimming, biking, running races, and spending time with her family. This 4-part series with Kym is jam-packed with explanations, tips, and science behind many of the hot topics of functional medicine, as we cover Kym's health journey and an overview of functional medicine in Episode 1, Functional Medicine's Approach to Gut Health in Episode 2, Balancing Act, Women's Hormones Explained in Episode 3, and environmental toxins and their link to autoimmune or chronic illnesses in Episode 4. Kym is a super deep wealth of knowledge. She has a ton of certifications, and she is making a difference to so many people already in our area, and we can't wait for you to learn from her. So let's get started with today's episode.
Hey guys, welcome back to the podcast. We're back here with Kym from Innate Healing, and we're super excited to have you back here. We talked all about your story in the last episode and delved into how you help people, especially with their gut health and hormone health. And we're going to be talking about gut health with this. So a functional medicine approach to that. So gut health is a buzzword, I believe. I mean, especially if you listen to podcasts like these and health and wellness, you hear a lot about gut health. So what does that actually mean? Does that just mean like eat healthy food? Right? Or what does that mean? Maybe dive into a bit of the microbiome or whatever it is. What is gut health?
Yeah, definitely. It is for sure a buzzword. Gut health, it can relate to, I predominantly say it's kind of what's going on in your microbiome, and then the microbiome is sort of all these little microbes that make up your digestive tract and the kind of terrain or the environment in there. And you really want those to be in a balance. The key word is balance there, and not have an overgrowth of something or missing something or kind of deficiency in something. And that's what kind of lays the foundation for you being able to like fully absorb all your nutrients, supplements, whole foods that you're eating. And when there's imbalances in there, that's when people start to get digestive and gut issues such as bloating. They can have fatigue. They can have indigestion or kind of upper stomach issues, lower stomach and small bowel issues, loose stools, constipation, acne. A lot of skin manifestations like rashes are actually kind of a direct correlation of what's going on in the gut, because you have a large portion of your immune system in there, and you also have a large portion of production of your serotonin in there. And that's kind of like your happy neurotransmitter.
Yeah. And I mean, you're kind of delving into this too, like not just because gut health is going to affect obviously your gut, it affects your whole body. Like what else does gut health affect in your body?
Yeah, the big one for sure is definitely this kind of gut and brain connection. So there's a lot of talk now about this kind of vagal nerve connection, which is basically a nerve that connects your brain to your gut and sends signals and information where it needs to be relayed. And everybody, most people know that a lot of like chemical reactions and functions in your body rely on the direct ability for those little messengers to get where they need to go. And when there's a disconnect or issues with that connection, it can lead to many kind of chronic health conditions.
Yeah. So like brain fog and like anxiety and all this other stuff is probably, it can be related to gut health then too.
Yeah, absolutely, for sure. Like mood issues, sleep, cognition, 100%. It can definitely have a portion of that being related to what's going on in your gut. And it's honestly, it's one of the best places to begin when you're working on health issues is the gut.
Yeah. What other like why are gut issues so prevalent now? I mean, we touched a little bit on this in the last episode, but why do you think that it seems like there's more talk about it? Why there's more issues coming from gut health?
Yeah, I think that's just because at any given point in time, I always kind of tell people we have these external insults, I call them, that are coming into the body, and that requires us to kind of focus and give a little love and attention to our gut and microbiome on a regular basis. And so it is things like pesticides and chemicals that are in our foods. We try to eat organic as much as we can, or we give people strategies for cleaning their foods, trying to stay away from like microplastics. And we call them these kind of forever chemicals and parabens and phthalates that are coming in from, scented things. So we really focus on trying to eliminate those. But the exposure will kind of always be there. We never live in this sort of perfect environment, right? And a lot of us, there's this huge movement in homes to, making sourdough and homemade foods and things like that, because we have a lot of soil depletion, and that's where they're coming from. But also just exposure to, you can kind of pick up like different toxins or bugs or overgrowth of those, just from, if you're like overseas or eating raw foods or things like that. This is where people tend to kind of pick up some things. And if the foundation isn't good, your body's not going to be able to fight that off. And so that's when you tend to start to see these overgrowths. A lot of things like I'm looking at is kind of small intestinal bacterial overgrowths for people. We call that sort of, and it can go hand in hand with dysbiosis. And that's just a fancy word for saying, hey, you have an imbalance of your good gut microbes and the bad microbes. And so when those are out of balance, most people are going to start to tend to experience digestive issues.
Is that similar to leaky gut or is that different?
Different.
Okay.
Yeah, leaky gut is also a buzz term, I would
Sure,
say.
yeah, absolutely.
For sure. But even though as much as it is kind of talked about or the word is thrown around, some people still are unaware of really what that means. But so I'll kind of dive into that here. But we're supposed to have these nice, they're called tight junctions in our epithelial. It's kind of this barrier that is built. It's the foundation for in the gut lumen or the digestive tract, if you will. And think of it like a wall and kind of a barricade. But we're supposed to have these, if you think of it like a brick by brick, they're supposed to be nice, snug, tight together. But what happens from, I would say, these kind of external factors or triggers, we call them, these can be things like stress. Like stress can literally induce leaky gut. And like I said, I'll mention more of what that is, but it can be like stress. It can be chemical exposure. It can be toxin exposure, microbe exposure, even like prescription medications, things that are like dyes and chemicals and unnecessary fillers, things that kind of can be more harmful to the body. Those things start to come in, and over time, they create an insult to the gut where the gut becomes, that's where the term leaky comes, because those nice tight junctions, there starts to be gaps in there. And what happens is, instead of your body and your gut sort of absorbing all the nutrients and minerals and the foods and even supplements or prescriptions, a portion of that, and it's supposed to be like a nice active passive, and getting back to my kind of biology days and science classes, there's supposed to be this nice active and passive transfusion of these things in the gut. And when that doesn't happen, when there's little like leaky portions and holes, the things will go straight into the bloodstream. And if you know anything really in the medical field, you know that things that go directly into the bloodstream can kind of wreak havoc. In more severe cases, we call that like sepsis, where they get back, infections in the blood. And that can shut down people's bodies, like their organs kind of go in this shutdown mode because the body's trying to protect itself in any way that it can. And so when I'm describing it to people, I often call it like a little mini version of that, where you're getting like a little mini exposure into the bloodstream every day, slowly. And your body is sitting there reacting, and it says, hey, these things are not supposed to be in the blood. And we need to figure out a way to defend ourselves from that. And that's when people start to exhibit chronic health conditions with, blood pressure, cholesterol issues, this huge explosion we've had in autoimmune conditions in society. And it kind of lays sometimes groundwork too for cancer. So, that's really where it's coming from. And that's really what the term leaky gut means. And so we work to kind of get those junctions to be nice and tight again.
So how do you do that? Obviously, you've talked about doing testing, and you've also talked about changing your environmental factors, which we're going to cover in episode 4, is actually changing your environment. But how do you fix this? Is it nutrition? Is it supplements? What do you do?
Yeah, definitely. When you're dealing with autoimmune conditions, for sure, and a lot of different chronic health conditions, nutrition is huge. So in functional medicine approaches, we never want to be completely restrictive to someone's diet. And I always kind of say, if I'm working on something where I have a case where it's very clear clinically to me, the picture, especially with blood work and labs, because we can do blood work. I also do it's called a gut or a microbiome test. The one I use is from Diagnostic Solutions. It's called a GI map, but I'll break that down for you guys too. But we get an overall picture of what's going on. And when I find things from there, I ask my clients to be a little bit more strict. Like, hey, we are going to go on a anti-candida diet for 6 weeks. We're going to go on an elimination diet. I have different ones that I've learned through training. We can do cardiometabolic guided. And I always say this is really a guide. But when there's something very, very big going on, yes, I ask them to be pretty strict about it, because that is going to be the most powerful component to healing their chronic disease issue. Hands down, 100% is going to be the nutrition component. But we can speed things up by knowing what's going on in their gut and their microbiome, and knowing if they have a component of the leaky gut. And so we use elements to kind of repair that. It's not as clear cut or straightforward as you might think. So you might be like, okay, let's heal. We know most people probably are dealing with leaky gut, right? If you've never thought about your gut health, or you've never done anything to ever help your gut, you'll just be like, all right, I have leaky gut, so I'm going to go take these supplements. And you're going to, some of these supplements are like, you're getting short chain fatty acids like butyrate. You're getting L-glutamate. And it actually comes down to how much the dosing you're doing too. So that's another component of where my background in pharmacology actually comes into play, because I use all that knowledge for supplements. So you actually have to have the right dose too for what you're dealing with, because many supplements, marketing is huge. So you can slap a fancy label on anything. Let me tell you that. Because I was roped in so many times, like, oh, this is going to cure my problem. Spent thousands of dollars just buying random supplements that they really got me. I just read this and it said it was going to fix all this and XYZ. And then I'm looking a little bit deeper, and you see that some of these, even combined supplements, I'm not entirely sure, how much dosage is in there, and the tinctures and stuff like that. And they can be good tools for sure. But sometimes it can come down to, did you have the proper doses of what you really needed? And so I hand select all my supplements and things that I'm recommending for clients. And I tell them how long they're going to take them, why they're taking it, when they don't need to take it anymore, because we should really switch that shift to whole foods after we've kind of, done a lot of healing. But, using anti-inflammatory agents, like a lot of aloe vera, slippery elm, licorice root, L-carnosine, so zinc carnosine. These are just things, amino acids, like they help build up the gut barrier lining again. So those are all just tools for sure, straightforward. I can tell you that.
So then how do you know when it is at a healthy point? Do you do retesting, or is it more symptom based, and then how do you maintain after that?
Perfect question. Because I get this question all the time from clients. My philosophy is that functional testing in general is, it's expensive. There's a commitment. Like when you go into functional medicine, like it is a commitment into the finance portion of it. But I do always kind of tell people, because some of the test companies, they charge what they charge for their tests, and that's that. But there's a component of it, like knowing, like I kind of tell people, you're paying for your result. If I could go back 10 years and someone said, you're going to pay XYZ, but this is going to be your result, I would pay it. I don't, that's just kind of me because of how terrible I was feeling with my health. To me, there couldn't be a price that could be put on like my health and my wellness for the rest of my life. So, but yes, so good question. We generally are working on things. I mean, gut health in general, you're working on things for about 3 to 6 months. Solidly. Some people are a little bit faster in moving the needle. Some people take a little bit longer, because that's the other missing component is if you're dealing with like overgrowth and other issues, just adding in a supplement for leaky gut isn't necessarily going to solve the problem, because there's actually a step-by-step approach. And I've done educational seminars and webinars where I kind of get into this like 5R approach. But when there's an overgrowth or an infection or something going on, that's often the kind of root cause, if you will, of things that are stealing your nutrients, stealing your benefits. Because if you're eating good foods and whole foods, you should feel those. If you're taking like good professional grade supplements, you should feel those. And my clients are saying things like, I've taken all these supplements, I'm eating healthy, like I've cut out dairy, I've cut out gluten, blah, 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 and I still don't feel better. And then that's where I'm like, there's something further going on. I can't exactly tell you what. I'll try the best I can with symptom assessment for sure. But there's thousands of probiotics on the market. Go into the probiotic industry if you want to make some money, because that's the new thing coming out, and how related those are to our health and wellness. But you could be missing something, or you could have an overgrowth of something. So not everybody needs the same exact probiotics. They also range from like 5,000 to like 100,000 billion units. There's like Akkermansia, there's these butyrate strains, there's prebiotics, probiotics, postbiotics. So you need to know when to use them, how to use them. So it is complex.
So you help people navigate the world of probiotics and help them understand which ones they should be on?
Absolutely. 100% do that. And yeah, so I'm usually working with people to tell them like how long they're going to take this supplement for. And as for your question about retesting, I don't as much. My goal is I want to know if you're feeling better. That's the ultimate win for me, because I really, really believe that I'm trying to get away from this. This is what's on paper, and this is what everything says here in this kind of right on the screen, because we need to marry how you're feeling, your symptoms. That's the most important part to me.
That's the goal, right?
Yeah, that's the ultimate goal. Like you should be seeing and feeling the improvement every day from the things that we're doing. And that's the ultimate goal for me, for sure. And I don't, I'll retest things for people like hormones and stuff we do usually like every 6 months or so. But the gut things, not necessarily. If someone wants to, like if they have an H. pylori infection or something like that, and they want to retest to see if they eradicated it, because that's a tough one. You got to work a little bit at that one. So we go through strategies to help heal that, but not necessarily retesting all the time. Mm-mm.
What's the difference between probiotics, prebiotics? I think there's also postbiotics, and then things that you can have in your home, like sauerkraut and kombucha. And like, what are the differences between all these things?
Yes. It kind of comes down to the strain. So a probiotic, the two biggest ones are going to be the two biggest strains that are often in probiotics that are the most heavily researched are going to be lactobacillus strains and bifidobacterium strains. And the funny thing about is when I see gut testing, sometimes somebody will have like way too much lactobacillus and they have like no bifidobacterium. So they only need like a bifido. They don't need a combination probiotic. And that's why if they say, I'm taking this probiotic, it's like 10 billion things, and it's honestly making me feel worse or something, that's just because maybe you're getting too much lactobacillus and you only need just that particular other strain. So don't buy this combo product.
No, that's really interesting. I feel like probiotics are, everybody thinks they should have one. So
Yeah.
that's a really good point.
Well,
You
and this
really
is
know
why
which
you
one you should
yeah.
be taking.
And this is why you specify, this is why you really individualize each person's needs, right?
Yeah, absolutely. And to your point, I mean, if people have like really extreme like histamine intolerances, they're not going to respond well to like kombucha or, and that's where they'll say like, well, I had that and it just made me get like really flushing in the face or red or they don't have a good response to it. That tells me things. So your reaction to a supplement tells me things as well. And I can use that and kind of run with it a little bit deeper too. Because if it's sort of, I call it poking the bear. If you have a response to this, it tells me that something's going on in there that we need to work on. Sometimes people don't always dive in right away. They want just tell me a probiotic that's going to help my indigestion or my bloating or whatever it is. And I give them, sort of, maybe I can give them a general one, but I always I really tell them, okay, if you're struggling this long for it, let's do the microbiome test and it will probably be the single-handed best thing that you invest in for your health for years to come. And you come back to it too, because when I like help people, I don't, my ultimate goal isn't to like hold on to them, if you will, as a client forever. My goal is to teach them how to be their own doctor of their body. And so if they're feeling crummy again or something, they're going to be like, you know what, Kym and I worked on this a year ago and I absolutely felt tremendous when we did XYZ together. So I'm going to go back into my little notes that we talked about together. And maybe I'm going to restart doing this little protocol or regimen that we were working on together. And I feel like I was doing well with that when I was focusing on that for another 3 months or so. Because you'll always have these time periods where we get out of balance or imbalances just based on, different stages of our life in general. But I want them to just come back to the foundations and the things that we worked on together. And you'll still find a lot of restoration there. But prebiotics, so probiotics, yeah, they can kind of like fight off, I would say, like a little bit of overgrowth and types of things. You definitely need a little bit more targeted approach if you're dealing with particular, like, it depends on like how much small overgrowth in the bowel there is, overgrowth of candida. Ooh, we get into like I use a lot of antimicrobials for that. So, you can, conventional practice, obviously they'll use like antibiotics, which many people, there's no right or wrong. I'm not saying antibiotics are wrong. I'm just saying that some people will say, I took that antibiotic and now I just feel a lot worse after. And that's just because antibiotics can kind of deplete the microbiome in general. So if you're going to use the antibiotics, like it's definitely wise to use a good, like solid, like foundational probiotic while you're doing that. Make sure you separate them. Here's my little pharmacology tip for the day. Don't take your probiotic at the same time as your antibiotic. You got to separate them. But it's like you can restore and recover, and there's absolutely like sometimes you just need that antibiotic. I mean, I had my wisdom teeth out like a year and a half ago, and I need it. I had like I had the, what do you call them, the sockets or dry sockets there, and I really needed that antibiotic. And so kind of just what I did was bit the bullet and did it, and then I just worked on gut health extensively after that, and to replenish, and a lot of things are going well after that. But so there's time and place, and then prebiotics, they actually, once you get your gut populated with probiotics, you give yourself, so you want to switch. Usually I'm telling people switching their probiotics every 3 months or so the body doesn't become like tolerant to it. But once you feed the body the probiotics on a regular basis, you want to incorporate in generally a prebiotic later, because that will actually feed your good bacteria to keep them there, right? To keep them in place and have them stay there. So I said it's like food for the probiotics and the microbes that are in there. And then postbiotics, they're like the newer kind of on the scene study, but they're more a lot of antimicrobial and like replenishment of the DNA in the gut. Again, sodium butyrate is probably just one of the best postbiotics anybody could be taking. I actually have to take that one every day because I don't have my large intestine or colon, and it's primarily populated in that area. So I found that now, because I don't have that portion of my digestive tract, I kind of have to feed that to my body all the time. But that definitely helps with like bowel movement, sleep. It'll help repair damaged cells, because through the insults, you can get inflammation and damage to your cells in your colon and digestive tract. And so that's what the postbiotics are for.
Can we talk just briefly too about like parasites too? Because that's something else that, happens in the gut and people get into that. So can you talk about like what parasites are and, what's the deal with that in your gut?
Yeah, for sure. I feel like I love that you even brought that topic up, because some people are like, oh no, that's voodoo and like that doesn't exist.
Ew.
And let me tell you, it does. But still people tell me that say it doesn't exist. Because I'll tell you that the stool testing or things that you're getting tested at the hospital are different than the functional tests that we do as well too. Because I've had clients be like, nope, I literally tested for H. pylori and they said I didn't have it. And we do a different method of testing and they have a red flag because all their symptoms are screaming it, which also allows me to marry it with the test result too. Because that's the huge piece of the puzzle too, is just marrying those symptoms. But parasites, yes. So those guys, they actually are difficult to detect sometimes with just functional testing. So this is in general where you'll hear other countries, they actually parasite cleanse, if you will, like twice a year, just because we can acquire these and they're very stealthy. So I say they don't always even show up on like a gut or a GI test, but they will basically be kind of hidden in your body and different organs and things like that. And they can, like the liver and the gut and kidneys and things like that. And they basically are going to steal your nutrients, steal any benefits that you're getting from supplements, whole foods. A huge indicator of that can be sometimes I can just look at somebody's CBC differential, their neutrophil percent, those percentages. That's like a little root cause. And most people have that done by their regular doctor, a CBC with differential. It's an overview and gives me an idea of what you might be dealing with for if I'm looking at like eosinophil percentages or basophil percentages. If they're over specific numbers, I have an idea that you might benefit from doing a parasite cleanse. But another huge indicator is chronically low iron, because it feeds off of iron. So ferritin levels that are low and just feeling tired like all the time. So yeah, I'm going to be doing a community one through my business. So great that you brought that up.
Yeah,
but
yep.
So if you're looking to do one together with support, so I can help guide you through, because a lot of it is what happens is when you take very specific herbals that basically target them is what it is. And there's different companies out there. I use one called like Cellcore Biosciences. There's another company called Parify, which is like liquid tincture drops, is very well known in the functional medicine community. But what I found is doing them together can be way better than doing it on your own. I always joke, I've self-inflicted a lot. I've done a lot of these things myself. I've sort of poked the bear, if you will. I've done parasite cleansing. I've done a lot of liver cleansing and flushing, because when we talk about hormones, you will understand how important the liver is to your hormones.
Yeah.
When is this parasite cleanse event? When are you doing this?
Yeah, I think we're going to be setting up probably in late October and November. So stay tuned and stay connected with me, because we're going to do a community one. So what I'll do is I'll end up getting the kits and everything for anybody who's interested in doing it. And then we'll have a Facebook group set up, and I'll basically guide you through it, like what you can expect, things that you should be eating during this time. Generally, you want to do them around the full moon, because that's when they quote unquote say they're more likely to be like active in the body and out in the body.
How long is it? Is it like 7 days or is it like,
I was just about to say that. Yeah. They're usually about a week long. And then if you exhibit benefit from that, sometimes you want to kind of redo it in another month or so. Or if you're feeling like you're noticing the body releasing some things, oftentimes it's in bowel movements, but then you can kind of keep going with it. So I kind of let people know what to do when you have those specific reactions. But generally, you can feel a little bit crummy when you do it, but then there's this huge like ball of energy and restoration like the days to come after. So,
wow. So how do they sign up and how do they get a hold of you?
I'll give you all that. I'll be giving all that information in November. But yeah, you'll hear about it if you're staying connected to my newsletter and through Instagram and Facebook right now.
Okay. And that's in innatehealingandperformance.com?
Yes.
Is that right?
Mm-hmm.
All right. Awesome. Well, thanks so much for telling us all about gut health and your approach to it. This was super interesting. I absolutely loved listening to all that. And hopefully you guys listening took a lot from that too. So we're also going to be talking about hormonal balance, and we're going to be talking about toxins as well in the environment in the upcoming episodes. So stay tuned for that, and we'll see you soon.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.